Coming up next on Arizona Horizon, new data that reveals surprising numbers surrounding homelessness and questions arise about its accuracy. Also tonight, youth suicide rates are declining, how one hospital in the valley is working to help those numbers go down. And a new exhibit at the Phoenix Art Museum celebrates the artwork of 36 women artists from Japan. Those stories and more next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your public television station.
Good evening and welcome to Arizona Horizon. I'm Steve Goldstein filling in for Ted Simons. Each year, the Maricopa Association of Governments point-in-time count draws attention to numbers surrounding homelessness, but questions have arisen about the accuracy of the count. And joining me for more on this data is Tanner Swanson, Marketing Director of A New Leaf, a nonprofit focused on helping Arizonans overcome crisis and achieve long-term stability. Thanks very much for being here.
Thank you.
So let's start off with what the good things, the best things about having a survey, a study like Point in Time.
Yeah, so I participated in the count myself this year, and the PIT count, point in time count, is really about getting, it's hitting pavement, going out there and trying to meet people who are actively experiencing homelessness. And it's very helpful. It's a one-day activity though, right? So it gives us a good survey for that time. Now, the concern that we've kind of put out there is just a lot of community leaders tend to look at that report and they say, what is that report telling us? Oh, okay, so 9,000 some odd people experienced homelessness. Well, it can't be that bad, right? Yeah. And to us, we say, let's look at it in context, right? It's a snapshot.
Well, exactly. It's one of those things that it kind of surprises me to hear you say that something that is done just for one night is something that the policymakers are so focused on. So let me ask you this. What are some of the ways that it can improve, and is it just as simple as maybe doing it more often?
It is useful as a one-time activity. So the whole nation does this, and Maricopa Association of Governments does a great job of coordinating with all the municipalities across the county to get a good and accurate count. And I think we do that. But where we can improve is there's a ton of research out there that shows that you can augment that data and put it in context. So first is, one of the things that we put in a recent op-ed we published about this was schools all across Arizona have ways of measuring whether or not their students are experiencing homelessness, right? And the Arizona Department of Education published that tens of thousands of students were experiencing homelessness last year. And when you look at the count, there's maybe a few thousand that are actually listed as children. And when you think about it too, intuitively, you know that you're not going to be out with children living on the street, right? You're going to be trying to figure out any solution you can to stay out of sight, keep your kids, and try to get back into an apartment. So pulling that data from Arizona Department of Education and other places too, to augment the data can be helpful.
So building off of that, what are other concerns related to having something be not as accurate as it possibly could be? Does it give people the wrong impression potentially that the homelessness problem or the unhoused problem is actually not as dramatic as maybe we tend to think it actually is? Does it give people an idea that, I'm not saying there isn't progress being made, but is it an idea that more progress is being made than actually is?
I think so. I think the biggest things hiding the crisis are the ones that keep people out of the PIT count, right? It's different generations moving into apartments where you have 8, 9, 10 people living in a 2-bedroom home, right? That's very difficult. And that's where the kids are, right? It's people living in their cars and, posting up for the night in a Walmart or something. And those are the people that we're not counting. And these are tens of thousands of people, right? I don't think it's any exaggeration if we know tens of thousands of children are experiencing homelessness, that more than that in terms of adults are experiencing homelessness. And we're not getting their story. So yes, very useful snapshot, but again, it is meant to be a snapshot.
So if it is a snapshot and it's not as accurate as we'd like it to be, how could that affect programs? How could that affect funding? Because again, maybe the emphasis isn't quite there. People sort of pat themselves on the back to some extent and say, wait a second, we're making a lot. Why do you need an extra $50 million to try to build new housing or what it may be? Does that end up causing a problem? Have you seen it cause a problem so far?
I think it does to a certain degree. Because everyone interprets these data points differently, and usually especially policymakers, electeds, they have to make decisions very quickly, right? And so they get the best data they can and they try to make decisions. I think people who work in this full time, if you have dedicated people working on homelessness for the city of Mesa or city of Phoenix, they know this data is incomplete and that they need to work around it. But the broader discussion, the statewide discussion, the regional discussion here in the Valley can be dictated by this more limited number. And that's really what we at A New Leaf wanted to speak out about is, it's a bigger number than most people think.
Well, so the fact that Point in Time is a national project, I presume that makes it harder to modify it, because again, I sort of come back to my first question, which is, well, okay, if this is just a good snapshot, well, we know what snapshots are. They're incomplete. So is it a possibility, is there work being done behind the scenes by organizations like yours to say, wait a second, Point in Time is great, let's not get rid of it, but can we do something really, again, is there momentum to do something different? Yeah,
the National Coalition around homelessness, healthcare for homelessness, there's a couple that do this work, and they publish studies that show that augmented data that you can get from the Department of Education, Department of Economic Security, prison systems, right? You can pull this data and use it to augment, and it's a little more difficult, and it requires a little bit more of the administrative state to put that together. But that is something that we can do. There are states that have done that, and it's given them a more accurate prediction of homelessness, and it's allowed them to combat the challenge better. Investing in affordable housing, homelessness courts where you're preventing people just cycling into the prison system, right? All these different solutions, but that takes good data.
Okay. Tanner, thanks for the work you do, and thanks for being here.
Thank you.
Arizona PBS wants to wish a very happy birthday to our Arizona PBS Kids Club members that are having a birthday. Thanks so much for being a part of the Arizona PBS Kids Club. And if you'd like to see your name here during your birthday month, get a grown-up's help to visit azpbs.org/family to learn about our Arizona PBS family membership. So happy birthday from all of us at Arizona PBS.
So where's the body?
The most dreadful thing has happened.
Well, I've got a hunch.
What's that?
It looks like some sort of code.
He's hiding something. Then we keep digging.
Okay, let's go.
So, sit back, relax, and enjoy.
It should stimulate all your senses.
A new study by the Journal of the American Medical Association reveals that youth suicide is going down. Phoenix Children's Hospital works towards that goal every day through integrated behavioral health services and its suicide screening program. Joining us now is Dr. Carla C. Allen, Division Chief for Psychology for Phoenix Children's. Welcome. Thanks very much for being here.
Thanks for having me.
So when we see numbers that indicate youth suicide is going down by a little over 10%, obviously that in and of itself is encouraging, but what's most encouraging about some of the factors that may be leading to that?
What I find so encouraging about that is that's a relation of increased access to care. So that's because of the increased access to 988, which is a crisis intervention phone line and text line that kids can call when they're in trouble.
Okay. I'm most intrigued, frankly, about a lot of things, but I will say the one thing with the Phoenix Children's has the universal suicide screening. Can you explain that and sort of what goes into that and how universal obviously means everybody?
It does, yeah. Universal means everybody, and the great thing about that is not everyone has equal access to great quality behavioral health care. So we bake it into our medical visits, and we universally screen kids across our entire health system, 10 and up, for suicide risk. And when we find out that they're at risk, we connect them immediately, before they leave that exam room even, to highly trained clinicians who can help.
So someone with your training, it may seem obvious, but for those who are lay people, and we hear, what are some of the questions that need to be asked, and when is it clear that someone may be facing risk factors?
Well, we know it's important to ask directly. about suicide, to not talk around it, because sometimes we miss that risk if we ask other questions in different ways. And we don't plant the seed by asking either. So it's really important to say, have you been thinking about killing yourself? Have you been feeling like a burden to other people? Do you wish you could go to sleep and not wake up? Asking directly really it shows you care.
So some people will say, now, you're saying that isn't planting the seed. Mm-hmm. It isn't.
It is not planting the seed. We have great research demonstrating that not only is it not planting the seed, it's giving people a real lifeline to hope when they're otherwise struggling.
Okay. So have you gotten any pushback from parents who will say, I'm not sure I would like even a psychologist asking those sorts of questions?
I would say increasingly the answer to that is much less so than we used to, right? So public awareness has really increased, as has stigmas decreased. Which really allows us to ask these questions most of the time. And when we explain to parents, this is the way that we find out so that we can help your child, because we care about their whole selves, not just their medical health, parents are willing, yeah.
So it's exciting that Phoenix Children's does this integrative situation. So let me ask you about the ER. If a young person's in the ER, where is the suicide prevention aspect to that?
It's baked in right from the moment they walk in, right? So we have trained clinicians who are, they know the evidence-based interventions for suicide risk. We ask those questions directly at the point of triage, and they get immediate help to life-saving care while they're there from a trained clinician.
Bridge Clinic, I have to ask about that as well. Tell us about that.
Bridge Clinic is our way of making sure that when kids leave the emergency room, that their care doesn't stop with us. So it's short-term sort of care that we give to kids while we help them find a behavioral health provider in the community nearer to them. So far, we've served nearly 1,200 kids through 4,000 appointments in that way, and it shows that it works. It reduces future visits to the emergency room.
So are we finding that kids are more or less mature than we think they are when it comes to dealing with some of the challenges of life? And how much does some of the work at Phoenix Children's dig into that a bit to learn more?
I really feel that when you're talking about suicide, you're talking about who am I in this world? What's my meaning? What's my purpose? And when you can connect with someone who sees that and knows how to walk you through your own journey to self-discovery, to the answers to those questions, you'd be amazed at what kids can do.
This may be an odd question, but I'm wondering, when you have clinicians and whatnot, does it ever help to have people who maybe when they were teens may have had, not taken action on it, but may have had some of those troubling thoughts themselves?
Absolutely. I myself have lived experience. I lost my sister to suicide, which is the reason I do this, right? And so when you learn what that's like and the way that people really think when they're going through that, you can connect to them so much better, especially when you learn evidence-based care.
Obviously, sorry to hear about your sister. Then this may be an obvious question, is what are some of the factors that even parents can start to look for in their kids to, again, not to hover, and not to, but to care and to see, okay, there are some things that are maybe making me nervous about my child?
I would say first and foremost, if you're nervous, talk to them. Ask, don't wait. But some of the warning signs include things like, your sleep really changes, you're cut off from your friends, you're more isolated. These are bigger behavioral changes. I'm no longer interested in soccer, even though I always cared about that. Those are all warning signs, including increased agitation.
So my last question for you, we only have maybe 30 seconds or so, and it's a big one. Social media gets blamed for everything. It's the scourge of our lives. Is there something going on in social media that could actually be used as an aid as opposed to a negative when it comes to this sort of thing?
I think so. When you think about risk for suicide, social connection is certainly one of those things. And so when we can use social media for good to connect people towards healthy living and real people connection too, right? Real world, live sort of activities can be tremendously helpful.
Okay. Dr. Ella, thank you. Thanks for being here.
Thank you for having me.
In the male-dominated field of Japanese studio ceramics, Phoenix Art Museum is highlighting the works of 36 Japanese women artists who push the boundaries of sculptural expression. And to tell us more, we're joined by Colin Pearson, curator for Art of Asia for Phoenix Art Museum. Thanks very much for being here.
Thanks for having me, Steve.
So why is the timing right for an exhibition like this? Why is it important?
I think it's just, well, it's always a good time. People will see how great these sculptures are and they'll wonder why they haven't seen them before. But, you know, you said it exactly right. Women have largely been left out of the tremendous artistic traditions in Japan. But this exhibition, Radical Clay, really shows that they found their own way and have done some radically different things, and just by simply going around all the traditions and doing their own thing.
Well, we'll look at a few in a moment, but I'm especially curious about, maybe this is just me, that the exhibition features artists who were born, let's say, before World War II, some in the 30s, but we also see some that were born as late as, what, the late 1960s. How important was it to find that spread, and how did that affect the sort of art we're going to see?
Yeah, most of the artists are still alive and well and producing works. There are actually sort of 2.5 generations of artists, some that started earlier and became mentors to some of the later ones. But really, overall, it is not a group or collective of artists. They're all doing their own things independently.
So when we look at certain sculptures and certain works of art, will we notice an evolution of sorts, or is it really individual to each artist?
I think the biggest thing that will strike people is the tremendous variety of these sculptures, and that they're all, I'm going to overuse the word radical here, but they're all radically different from each other. So I think anyone can walk into this exhibition and find something that will just pull them in and encourage them to take a really close look.
Other than tradition, which we know many nations hold fast to, was there a particular reason that men dominated the field of ceramics? Was it just that women were not allowed in?
Yeah, that's basically that's the tradition. Yeah, there are some stories about women having been too good at something, and then, but the real cause is lost to time. But
Okay.
It's simply been that way for a very long time. Yeah.
So again, I'm holding off a little bit, but I wanted to ask you, where did your passion for Asian art come from?
Oh gosh. I've been passionate about Asian culture for many years, and I was very proud to have worked at the Musical Instrument Museum for over 10 years as curator of Asian music there, and I've switched to art, and so it's just been kind of a natural flow.
Okay. All right, well, let's look. Our first one I want to look at is called Red Vessel.
Yeah.
So describe that one for us and what it means and what it stands for.
So this is a wonderful, intensely red vessel, and it's self-descriptive, but the artist Ogawa Machiko has actually drew inspiration from the painted desert, from the landscape of Arizona, and so her use of that intensely red clay is a reflection of that, of the state of Arizona, which is pretty cool for a work of art from Japan.
It's a beautiful color, yeah. Next one is Eroding Flower.
This is by Shingu Sayaka, and it's really highlighting two of the themes that came to the surface in this exhibition. One of biomorphic design, where some of these artists are not just mimicking nature, they're creating sculptures that appear to be their own life forms, sometimes hybridized. And here she's merged the idea of a flower and geologic process of erosion, but also obsessive processes, where they do these intensely detail-oriented processes to construct these pieces, and also to make clay that's been fired and is thus very hard, make it appear soft and malleable, like the sort of stamen of this flower
No,
piece.
it's truly amazing. Let's look at Dream Flight. Oh, wow. Okay.
Yeah, so another great, this is Exhibit A for obsessive processes. So Dream Flight by Tanaka Tomomi, excuse me. She constructs, this is a detail shot, and she constructs these pieces out of thousands of little lamellae of clay that she carves out individually and pieces them together. So somehow she's able to make 5 or 6 of these a year.
Well, I was just going to ask you
Which
how
is
long it typically
mind-boggling.
takes. Yeah. God, okay. We have time to see bag work as well. Okay, so this is, again, the detail, and I'm speaking as someone who has no artistic ability of any kind, and to see this and to see the intricacies, but also the patience it must take to really figure this out and make it look as realistic as it does.
This piece is especially striking. Tanaka Yu is especially known for making these pieces that appear to be wrapped up in a very fine cloth. And she's really playing with us in several ways. Of course, it looks like fine cloth. It is sculpted clay. you just want to touch it.
Yeah.
This piece is also much larger than it looks in the photo, and it's really, it pulls people in. But she's also toying with us because this is what you do with a fine gift in Japan, and we can never unwrap that gift because you can't untie the non-fabric. Wow. So she's really playing with us in several ways.
Well, Colin, they're all beautiful. That was just 4 of, there's a lot more to be seen at the Phoenix Art Museum. Thanks so much for your time. We appreciate it.
Thanks so much.
And that's all for this edition of Arizona Horizon. I'm Steve Goldstein in for Ted Simons tonight. Thanks so much for watching.
Hello, I'm Alice Ferris, and we hope you enjoyed Arizona Horizon. For more than 40 years, viewers in Arizona have relied on Ted Simons and Arizona Horizon for in-depth coverage of issues of concern to our community. As you are probably aware, federal funding